Hey Dr. Gott, this is Cody Meadows, and today I'm going to be presenting my I Am a Change Agent presentation. Um, First off, to start, I'd like to start with an ethical paper. For this paper, we had to write about an ethical problem or dilemma that we have experienced within our nursing career. Unfortunately, I have not had the opportunity to deal with very many ethical situations, so I decided to write about one of my favorite television shows, which is House. House is basically a medical show about a doctor who goes about very unorthodox ways to treat his patients. But normally, his patients turn out okay, and it's the best treatment. He saves many, many lives. Well, one instance that sticks out in particular to me for like an ethical dilemma would be about a pregnant woman who came in to the doctor. They thought that she had had a stroke, but she had no signs of a stroke, nothing whenever she got there. She was perfectly fine. They ran tests, nothing was wrong, and then she started all of a sudden started having all these problems. They ran every test you could think of, and they could not figure out what it was. Finally, after multiple days and the mother getting worse and worse, they determined that she was experiencing mirror syndrome, which meant the fetus was actually having a problem, and it was creating symptoms in the mother. So they tried to treat the infant or the fetus, and with it really didn't work. They tried all kind of different things. So they decided that they kept telling the mother, like, we're gonna have to abort the baby, and in order for you to survive. The mother completely refused to harm the baby in any kind of way. She said that she would rather die with the baby than abort the baby. So therefore, none of the treatments were working. They decided to do surgery on the infant while it was still in the mother's abdomen. So they went in to do surgery. Surgery was going fine. All of a sudden, the mother started coding and went into BFib. And so they started doing CPR on her, trying to get her back. She wasn't coming back. They, defibrillated everything. Dr. House determined that the problem was actually with the fetus, not with the mother. So the fetus was actually causing the mother dysrhythmia. So he determined that the only thing to do would be to cut the umbilical cord, and the mother should have gone right back to normal and would have been saved. But this goes against everything that the mother stood for and that the mother had told them. The mother, before surgery, refused that anything happened to the baby or to abort the baby at any time, no matter if it meant her survival or not. So, luckily, there were some other doctors in the operating room with them. Well, the other doctors stood for the patient's rights and for what the patient said, and they argued with Dr. House and pretty much prevented him from trying to cut the umbilical cord, even though he knew that would save that cutting the umbilical cord would save the mother. This brings about a ethical dilemma, very severe, and you don't really have much time to think about it in a situation like that. You have to weigh out your options, but you have to go by what the patient says. If you don't, it's not just an ethical problem; it's a legal problem. If that would have happened, he would have cut the cord and the baby died, but the mother survived. The mother could actually sue him, the hospital, and so on. And it's also, violating the patient's rights, everything that she stood against. So this really brings about your kind of critical thinking skills on what other options you might be able to do. You having to weigh out your options. It also goes for like your decision making skills, because this is a trust time. There's so much pressure on you, high intensity. You have to make your decisions, and you have to make sure you make the right one, and you have to do it quick. So I feel like this paper really represents, having to make those decision skills, and having to do that. The more you make these decisions, the easier it'll get for you. The easier you'll be able to think under pressure, and the more you'll be able to know. I feel like this connects to the objectives in the course by it helps you evolve your decision making skills and being able to assess problems correctly, and it also brings about the legal issues that you have to deal with, especially if you become like a leadership position or so on. So your leadership skills definitely get improved by situations like this. Now we'll talk about the conflict paper. For the conflict paper, I wrote about a personal experience that I've had at work. Generally, all of our employees at work are wonderful. They're great workers. Well, we hired a new employee. He didn't really have any references because he was young, which is a problem we have a lot, because we're just now in college. And So we really didn't have a reference. We couldn't have any old bosses to call or anything like that. So we hired him, and he seemed like a great candidate. He fit in. He started working well. Well, he just kind of started slacking off a little bit. Then he started showing up to work late. And then it just got later and later and more repetitive, started having problems, and it continued. Well, eventually it got to the point where it kind of started, aggravating some of the other employees, started, interfering with our work, like the stuff we were trying to complete, like our projects and stuff at work. So the first step that I did was I kind of talked to him on a personal level. Personally, I use the avoidance strategy because I don't like to really upset people. I don't like to cause conflict, so I try to avoid it, and that causes a big problem because it just makes the problem worse. When I do deal with a problem, and I'm forced to, I'll try to use the compromise method. I try to be easygoing to where we can both kind of get a happy medium, or how we can both get what we want. Well, in this situation, like I said, at first I talked to him as a friend, and I just tried to inform him, like, hey man, you really need to, start showing up on time. Some of the other employees were starting to get a little aggravated. It's affecting our work progress and everything. And it really seemed like he kind of got the message or whatever. So going on from there, all of a sudden he started right back. He was showing up late to work again. He was being lazy on the job. He didn't want to help out. So then I really had to sit him down and have I'm actually a manager up there, so I had, manager to my, I'm his superior. So I talked to him and told him, I was like, repercussions are going to come if you don't start improving. We're going to have to start writing you up. We're going to have to, take action if nothing happens. Still, he continued to kind of be lazy on the job, was still showing up late to work. He even missed a couple shifts, and it just got way too far. So I went to my superior to tell him about the problem and figure out what we could do about it. Unfortunately, we had not documented any of this. So my superior told me that there's nothing we can do about it because nothing is documented. So therefore, it pushed our solution back even further. Well, because of this, the problem continued worse, and it was causing even continuous problems for other employees and our work progress. Finally, he kept showing up late. We documented. We had to write him up so many times, and we presented this to my superior, and unfortunately, the person actually had to be terminated from the job. A lot of things I learned from this are when you have a problem, you can't avoid it. You really need to go after it. You need to get it fixed and find a solution quick before it gets worse. Because if you just let a problem sit there, it's going to get worse and worse. It's going to affect more and more your work efficiency, your progress, your performance. Everything's just going to keep going down if you don't confront the problem. This comes about, and it really hits some of the hard areas of leadership, because you never want to hurt somebody, or you never want to fire somebody or get rid of them like that. You really want to try to help them out. And I feel like if I would have gone to him before when actions first started, and kind of been more stern with him and let him know what was going to happen, the possibilities that were happening, the repercussions that were going to happen, he may have tried to fix it. We also could have gone before any problems ever started when we first hired on, and set an example and told him straight up, if you don't work well, if you start showing up late, this is going to happen. And maybe he wouldn't have started it, because I feel like it just kind of snowball effect. He started showing up a little bit late, then he wasn't showing up at all. Started not doing as much, and he just got lazier and lazier, and then he wasn't doing anything on the job. So I feel like it pertains to the leadership skills about how to assess a problem and how to go about it. Your timing of it too, how you need to go at it more. You go at it quickly. Hit the problem quick, get it solved. That way you can work better and go from there. The ways to go about it also kind of help with your conflict solving skills, your problem solving skills. Another big thing I learned from that is documentation. You need to document everything. I know that's something they stress on us for nursing school, but it really is a big thing, and this could have been stopped well before it ever did if we just would have documented everything. It also tells us that, from his point of view, that we're accountable for our actions. That goes back to the ethical dilemma of Dr. House. Whatever he did, if he would have cut that cord, he was accountable for that. He was accountable for whatever happened to that patient. my worker, he was accountable for his actions by showing up late. Like, he got the repercussions from that, and it was on him. I feel like if we take these skills that we learn from problems like this, then we can really progress our leadership skills. We can promote some like change and stuff like within our workspaces. So whenever it happens in a healthcare setting, it can help improve our the way we interact with each other, the way we perform, the way we manage, and it also, like with Dr. House and him, it makes everybody accountable. Everybody needs to do their part, and by everybody being accountable for their actions, it just will help the overall growth and the development of the entire unit or my work area where I work. I feel like you can just better it. So this is how I feel like these two situations pertain to this class and how they have kind of changed me and taught me a good bit. So this is how I think this is really going to help us and develop my leadership skills that I can help pass on to others. Uh, thank you for your time and thank you for everything in this class. It's been wonderful. Thank you.